Hello, everyone. My name is Adele Mazzoleni, and today I'm going to be presenting barriers and facilitators to surgery for people experiencing homelessness in the UK. And I'm part of Incision UK. And this presentation and project was thought initially by Gillian. And yes, so today I'm just going to be presenting on this topic. And as you possibly know, Incision UK is a student association based in the UK from the Incision Global branch that deals with global surgery. So just as an introduction to this topic, we know that global health aims to achieve health equity, health equality for all patients everywhere in the world. And global surgery is a branch of global health that specifically deals with ensuring access to timely, quality, and affordable surgical care for all. Again, kind of without considering any financial sort of barrier or anything across the whole planet. Now, it's very important actually to keep in mind that global health and global surgery do not just include the low and middle income countries, but they also include individuals that are part of high income countries, but that are in disadvantaged groups in such places. And one of these groups include, for example, people experiencing homelessness. And it's sort of easy to say, to actually see how people experiencing homelessness are a vulnerable group. And actually the number of people that are experiencing this issue has been constantly, steadily increasing in time. And now we are reaching actually quite a high number. And what is one of the issues with this? Not only sort of the difficult life conditions, but also that physical health morbidities are more common in this group compared to the general population. So just as an example, people experiencing homelessness are more likely to suffer from the so-called trimorbidity, and therefore they are more likely to suffer from mental health problems, physical health problems, and also substance misuse. Trimorbidity is also a risk factor for unplanned hospital admissions and also readmissions post-surgery. And overall, people experiencing homelessness actually have an inadequate access to healthcare and have to usually rely on emergency treatment for trauma or any injuries. Now, if we continue on the background, inability to access healthcare services for this group of people is a particular and their main concern. Some certain issues have been kind of characterized and found regarding to this, and these are, for example, services that are often inflexible, negative, kind of appointment statements that is usually quite rigid and doesn't allow them to kind of reach healthcare services easily, but also kind of a negative staff attitudes towards them. And it's actually interesting to consider the fact that attitudes of healthcare workers towards what may be the barriers or the facilitators of people experiencing homelessness when accessing surgical care have not been explored in the UK yet. And therefore, it follows quite nicely that the aims of this study are to explore the perspectives of healthcare professionals and also key stakeholders regarding which may be the barriers and which the facilitators that people experiencing homelessness face when receiving surgical care in the United Kingdom. Now, what are the methods regarding recruitment of participants for this project? This will work through the Incision UK Groundswell networks via email and snowball sampling. So we know who Incision UK is, and Groundswell is a charity that basically wants to run research in regards to people experiencing homelessness and healthcare access. And what is snowball sampling? This is basically a method that can be used by researchers to generate a pool of participants for a research study through referrals made by individuals who all share a certain particular characteristic of research interest. We will collect consent prior to interview, and participants will be interviewed until we have reached data saturation, and that will be at around 20 participants. Now, in regards into the exclusion and inclusion criteria, those being interviewed should be over the age of 18. We will include GPs, surgeons, accident and emergency consultants, hostel workers, and volunteer organization workers. And they all must have worked with people experiencing homelessness, and also people experiencing homelessness and trying to access basically safe surgical care. And they all must be working in the UK as well. Now, in regards to the interviews, these will be semi-structured one-to-one interview that we will be conducting over Zoom using an integrated transcription software. And these are some of the questions that we will include. So, for example, we will be asking them if they think there is any issue in people experiencing homelessness accessing safe surgical care in the UK, including pre-surgery and follow-up post-operation. We'll ask if they can describe experience of this group of patients receiving surgical care that they have seen. We'll also ask what they think the main issues are, and if they have experienced any facilitators, and if so, why, and what these were, and if not, also why, and why that was the case, if they have an idea, basically. Following this, we will basically continue on data extraction, analysis, and handling. We will anonymize all participants. We will also delete all recording after these have been transcribed. We'll protect the recording in a password-protected file. And then the data will be analyzed basically following a framework method for qualitative research. And basically we are going to be interpreting the concepts, the themes, and the ideas raised during the interviews with the participants. Now, in regards to the results, we will carry these interviews after ethical approval has been obtained. We're in the process of that currently. And if we consider previous evidence, we can kind of have an idea of what the results might indicate, possibly. So, for instance, previous reports have highlighted people experiencing homelessness being denied access to care, and also facing negative experiences. And negative experiences have, for example, included discrimination and stigma against them, difficulties with the rigid opening hours of certain services, and there have also been issues reported when accessing primary care, as you can be imagined, especially in the UK, with kind of quite a strict address system for receiving and contacting the GP, for example. And this is very interesting because this is the first study of this type in the UK. And we might actually be able to find certain disparities in the care that this patient population is receiving. And we might actually help to improve and guide the practice in a more positive way in this instance. And we would also aim to increase the general understanding of this particular global surgical issue and of global surgery in general. The next steps will be complete ethical approval, recruit participants, run the interviews for data collection, analyze the interviews, and then follow with the write-up and the publication of the project. And what may be future research that could be interesting following this study? It could be interesting to interview people experiencing homelessness themselves to hear about their opinion when accessing surgical care. It could also be interesting to discuss this issue with trusts, health board, and charities, and also continue further work into possible facilitators. So what has worked and why it has worked. And obviously always continue on with education and advocacy for this group of patients. Yes, and I'd like to thank everyone and Infusion UK for running this project. And these are the references. Thank you.